Emergency Medical Minute presents Pharmacy Phriday, where emergency medicine clinical pharmacists join us to shed light on pharmacological topics.
Welcome back to Pharmacy Phriday. We're bringing it back. I'm Jeffrey Olson. I'm a second-year medical student at the University of Colorado, and I'm joined in studio today by Dr. Travis Barlock, a big contributor on the pod. We've had him on many times. And our special guest today is Dr. Callie Olson, PharmD. She is an emergency medicine pharmacist who practices at Denver Health, but has also worked at Swedish Hospital. Fun fact is all three of us went to the University of Denver together. Another fun fact is Callie and I are married.
No bias there.
No bias there, thank you. And Callie often does help out with the summaries for our medical minutes. So Callie, it's great to have you on. How are you doing today?
Good, thank you.
Good. And Dr. Barlock, how are you?
Oh, I'm fantastic. I'm excited for this.
Okay, good.
Very nervous.
Okay, so we're bringing back Pharmacy Phriday, and I have written a show for you two that has 5 segments. And each segment's going to be different. Some of them will have you guys collaborating, as you might do in the emergency room. And a few of them are going to be lightly competitive, which we know also sometimes happens in the emergency room. We're going to see how this goes. Hopefully you out there listening learn something and enjoy this kind of more fun, free-form episode. Okay, so starting with segment 1, I'm calling this the Get to Know You questionnaire. This is how we're going to get to know our guest, Callie, as well as we're going to learn a little bit more about Dr. Barlock. Are you ready?
Oh, yeah.
Yeah, let's try it.
Okay, so question number 1. This is for you, Callie. What's a book you read within the past year that you couldn't put down?
Oh, man. I read a lot of books last year. Most of it is trash. But I would say Fourth Wing.
Okay.
The world-renowned Fourth Wing.
And Travis?
For me, exhalation.
Yeah.
Exhalation.
Mm-hmm.
Okay.
A little bit more respectable.
All right. Question 2, Callie. What is the scariest drug?
Oh, potassium.
Okay. Maybe you can give us maybe a one sentence why you think that's the scariest drug.
Because it can cause arrhythmias if you have too little or too much, and it does come in vials of like very concentrated potassium that you need to dilute out before making NIVs. So if that goes up to the floor, it can be a really bad safety issue.
Interesting. All right, Travis.
Part of me wants to say Botox. I think by molecule for molecule, most dangerous substance on the planet. So I'm going to go with that one.
Nice. I like it. Another medical one. Callie, what is your favorite medical app or website?
App or website? I think I use MD Calc as an app quite often.
All right.
So probably that.
Good choice. Solid choice. Travis?
I really like WikiEM. I think it just kind of crystallizes important kind of take-home points of what I actually see on a day-to-day basis in the emergency room. So I like that one a lot.
Nice. Okay. Callie, what is one home remedy that you swear by?
Ooh. I think the most nifty one is probably using duct tape on like warts, or I think that's what I'm trying to say. So you can use duct tape and that will irritate it enough that eventually it'll just go away. But you have to be consistent.
Really?
Yeah.
Huh. Well, go figure.
What? I feel like you probably told me that.
There's no chance I told you that.
All right, Travis. One home remedy that you swear by.
Tea and honey. Yeah, I mean, I would say that for a cough or sore throat. I recommend that to families all the time.
Yeah.
Nice.
Honey is actually like pretty interesting, I feel, as a home remedy, because like that reminds me of when like button batteries, they tell you to give it give honey in increments until you can actually get them to the hospital, because they did all this fun like experiments on pig esophaguses, right? Esophagi? I don't know.
Esophagoxin.
What is it?
Nice. I'm sensing a pharmacy medical minute coming up here.
Honey?
Yes, on honey. Okay. All right. I wasn't sure if you were calling me honey or talking about honey. Okay. Callie, what is your signature dish?
Probably arugula salad with like a lemon and Parmesan.
Nice. Dr. Barlock?
It's not very exciting.
I like to cook this braised rack of lamb over carrots.
That's not real.
That is real.
Seriously?
I make that. Oh, yeah.
That must take a lot of time.
The hands-on time is very short, but then I can kind of cognitively offload it, and it's just it's braised in the oven. So
That's very
Depends
impressive.
on what you mean by time.
All right, Callie, back to you. Which medical historical figure do you admire the most?
Louis Gallman, he created the Poison Control Center, and he was a pharmacist. And that's a very proud moment for pharmacy, I think.
All right, Dr. Barlock.
For me, I guess the person I think of is actually Semmelweis. He's this, I think he was Austrian, but he was this physician who started noticing that there was a wide disparity in mortality in the obstetric unit of the hospital he was at between the patients that were getting taken care of by physicians and the ones that were taken care of by, I think it was by the nurses, and that the ones being taken care of by the physicians were dying at like a way higher rate. And he concluded that there was some substance that the doctors were communicating to the patients from dead bodies they were handling, and basically kind of came up with the idea of like hand washing. And it's a really actually kind of sad story of him publishing his like evidence for it and then getting kind of harassed and shunned from the community, and he ended up actually having a really, really sad kind of ending where I think he went to like a mental institution and was like abused there, and he died in a very sad way, but he actually did kind of change the world after that. So it was actually, I think that's actually really, really admirable.
Nice. But I knew you were going to have a good answer for that because you're always referencing various medical historical figures. Next question, Callie, which drug is the biggest prima donna in the hospital?
Okay, so will you clarify that? Like, prima donna is in what's the most annoying one to deal with, or the one that's the most exciting to work with?
No, I was kind of thinking maybe temperamental when I wrote this question,
Well,
but also exciting. I mean, a prima donna can be exciting.
I mean, I guess you would say probably the biggest prima donna, the one that's like the worst to deal with, is probably IVIG, just because it's a protein, so you have to be careful handling it. It can't be tubed anywhere. It's like thousands of dollars, and like I've had a few nurses accidentally drop it and smash it on the floor, which is not their fault. And then also the titration for it can be really difficult for nurses, and it's not that they can't do the math, it's just that it's really tricky sometimes, and you have to monitor it so frequently. And so I think it's just a lot of work on everybody's side, especially nursing, to do IVIG. And it's just a lot of money, so it's high stakes.
Nice. All right, Travis.
I don't know if I got a good answer. The thing that I was thinking of is just the drug that I swear people mess up all the time and requires like all the attention, and that's epi. I swear, just like handling it. It's just the one that we screw up the dosing, the route, the everything all the time.
There's way too many forms of epi, and that's why they took out the like ratios for epi. It's not like 1 in 1,000, 100,000 anymore.
Okay.
They just have like
Just
the
1
milligrams
mg
per whatever
ml.
mLs. Yeah, because then it just made it way harder with the ratio. So they
Yeah.
took that out. So it's no longer on packaging. You should look for it.
Yeah.
Nice. I think that's a really good answer. All right, Callie, pancakes or waffles?
Waffles.
Waffles.
Yeah.
Okay. Travis.
Pancakes.
Why? Waffles are like objectively better. They're like crispy on the outside and soft on the inside. And
They just demand a whole other entire cooking unit to make them.
but that's what makes them so special and delicious.
The prima donna of breakfast.
Absolutely. All right, last one. What is something in the hospital that you always need help with?
Yeah, so I think that the ER is a team-based group, and a lot of what I rely on as a pharmacist is ensuring that like nurses and doctors are giving me the information I need to help them make medical decisions. And so I really rely on their assessments to help me help them, essentially.
Nice. All right, and Dr. Barlock.
Well, I'll just piggyback off of that. I mean, that obviously the world of emergency medicine and medicine, at large is, a team-based sport. And I'd say to just hand that right back, that particularly with pharmacy, when I've got a patient who, the dosing is complicated for example, one, peds is very clear. Also, there's patients who are extremes of like BMI, for example, and you're trying to figure out, okay, well, what's like actually the right dosing of a medication to give here. And then things obviously escalate in complexity once you get allergies involved and other medications involved and, drug interactions. And so sometimes there's just times where you really need to provide the right therapeutic momentum from the get-go. Otherwise, just the way things go in the hospital of changing the medication someone's on, the antibiotics that they're on, or whatever, it just it takes a long time. And so just getting it right from the get-go is important, and that's obviously where our pharmacists come in very handy.
It's very nice.
Nice. Nice. And that leads perfectly into our next segment. This segment I'm calling Pharmacy Riddles. And this one, you guys are going to have to collaborate.
Uh-oh.
I've got a couple riddles for you two. So you're not competing here. This is totally collaborating to come up with the best answer.
You say we're not competing, but I see a score card right next to you.
That is for segment 3. Teaser for future there. Here is the first riddle. You can put that between you there. I'm going to read it for our listeners here. All right. Born in 19th century for gout, but later served a different bout, tiny in structure, tardy in action, hypothyroidism, and tremor, my adverse reactions.
Wow, that's really good.
Yeah, I did not write this one. I found this one.
Oh,
Okay.
Interesting.
Coming up next is one that I did write, but we'll put the credit in the show notes for this one.
So what's a gout treatment?
Allopurinol
I was about to say, that's got to
or
be...
colchicine.
Okay. I mean, because colchicine what can cause thyroid dysfunction and a tremor?
I think about like lithium can cause really bad tremor too, but that seems like weird. That'd be.
I know lithium was actually initially created as a diuretic.
There we go.
And
Okay.
so I feel like that's...
So that's out.
Yeah, that's out. I mean, what about like amiodarone or something? Is that what can cause what can destroy your thyroid?
It probably could, yes.
Yeah.
But I feel like maybe the answer is I feel like it probably is colchicine. I don't know if it causes tremor though. But colchicine's like a crazy drug.
Have we said it?
You have said it.
Okay.
Okay. All right. Man, born
Treat
in
gout.
for gout, but
I feel
later
like
served a different bout. That means it was
probably
made for that and not
colchicine's
anymore.
like really weird. It works on your telomeres, right? So
It works
it's
on
like-
your microtubules.
Okay.
Yes.
I feel like it has to be. I'm gonna say colchicine, but
Okay. I'll go in with that. I don't know. Is that right?
That is incorrect.
Is it amiodarone?
It's not amiodarone.
allopurinol
It's
then.
not allopurinol.
What?
Is it lithium?
Mhm, it is lithium.
What?
You're the worst.
I thought it was. I could have sworn that lithium was initially a diuretic.
So-
Then they found out that these mice started having different
Wow.
mood behaviors.
Well,
and
hey,
that-
I'm really proud of myself for being like, maybe it's lithium. Because
Wow.
that's like the big thing when you start people on lithium for like bipolar disorder is that they often have like tremors that make them stop.
Oh, okay.
Yeah, so that's why I thought of lithium.
Look at that.
Yeah.
So I totally set us askew.
And I did Google it real quick because you said that. And what I am finding here is that it does lower uric acid levels in the blood, but is not an effective treatment for gout.
I could've
And
told you
then
that.
there's also, I feel like you guys totally glossed over kind of dead giveaway here, the tiny in structure. Do we not?
Oh,
Tiny.
as in it's
structure.
just an element.
Yeah, well, and it's a particularly tiny element as well.
Oh, you're right. It is microtubules for colchicine.
I told you.
I know.
But I also told you that lithium was, not the answer. So I don't know.
All right, a chance to redeem yourselves. You can flip over that piece of paper and let's take a look at our next riddle. This one I did write. Okay. After his brother met an untimely demise, this substance found itself at the heart of an admirable prize. Inside every mitochondria, from the head to the toe, it looks at tight vessels and simply says no. It is available as a tablet, an ointment, an IV, transdermal too. Side effects include an explosive headache, overdose, and you'll turn blue.
Okay. I'm thinking like nitro.
Yeah, that's what I thought initially too.
Pruside? Or just nitroglycerin?
No, nitroprusside.
Nitroprusside?
I feel like you're right. It's probably a nitrogen
Just
containing drug.
yeah, I mean the headache, also turning blue with it, and
Because
then
of
also
the
tight
toxicity.
vessels. Simply says no. So. And simply says no. Is that NO?
Tight,
As
as in like
nitric
you will
oxide?
not. Yeah.
All right.
Okay, I'm okay.
Yeah.
Nitroproside.
Yeah, I think that's
Is it
right.
Nitroproside.
It is
Nitroglycerin?
nitroglycerin.
Nitroglycerin. Okay.
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 Any thoughts on the first part? After his brother met an untimely demise, story of the invention of nitroglycerin.
Did he like murder his brother with nitroglycerin by
No,
giving him too much?
His brother died from an accident involving nitroglycerin. Found itself at the heart of an
like a
admirable
fire?
prize. And
Oh, did they light it on fire like an explosion?
so nitroglycerin is a key component for dynamite, who this famous person invented, and then potentially maybe felt a little bit bad about its use in war, and then he invented a prize.
Oppenheimer?
I feel like maybe some recognition
Nobel?
from Travis over here. Yes,
Oh my gosh.
Alfred Nobel.
Really?
His brother died of a nitroglycerin. I believe it was a full-on explosion. Did invent dynamite, and then some people say that some guilt over its use in war made him create the Nobel Prize to kind of redeem his name.
No way.
Wow.
I didn't know
Yeah.
that.
Now it's so coveted.
Yeah. In researching to write this poem, I found some really interesting stuff about nitroglycerin, like how people that work in factories where there's a lot of nitroglycerin, they will on Sundays feel like they're having a heart attack. They call it like the Sunday heart attack because they leave the factory for a couple of days. They're not exposed to that nitroglycerin. And
Then their vessels
yeah.
all close up. And so they feel like they have a heart attack, right?
Yeah, and then there's
And that's how that works.
and apparently they don't feel that much better on Monday because they come back and then they get what's called like the Monday sickness as all their vessels open back up again. A very fascinating drug, that nitroglycerin. And then the overdose and you'll turn blue. Do we get what that is referencing?
Methemoglobinemia?
It is methemoglobinemia is a possible effect of a large enough overdose. So yeah,
I think I was thinking like, wait, it's cyanide toxicity with nitroprusside, right? Yes.
it could very well be. You are talking to a second year medical student. But,
Oh my gosh. Okay.
yeah. Okay. So I've got one more. This is more of a logic puzzle.
Okay.
So I don't have it written out for you, so you do have to listen very closely here. So you've been feeling very sick lately and decide to visit your doctor. He gives you 2 medications to take, medicine Y and medicine X. You're instructed you must take 1 pill every day of each, and they must be taken together. So 1 of X, 1 of Y. If you take less than that amount, you'll die from the illness. If you take more, you'll die from an overdose. So you're putting away the pills in your medicine cabinet, and you drop the bottles. 3 pills fall out. You count the remaining pills, and you realize that you must have 1 from bottle X and 2 from bottle Y. But unfortunately, the pills look completely identical. You have no way of telling them apart. How can you still save these pills on the floor, maintain your proper daily dosage, and take all of the pills?
That's interesting. So you could, and you have to take exactly the like one and one.
Could you like cut them? Is
Ah,
there-
yes. Okay, so I did bring a clue, but Callie has already
I
solved
was
it.
wondering, can you
handing
crush them?
Callie an object. Callie, what
if
is that
it's
object?
caustic? This is a pill cutter.
Okay. So that's the first part. Now just explain how that would work.
We
Wait, you have to cut them into all of them into halves. No.
Mm-hmm.
Yeah, you
Yep.
do.
That's the first step. You cut them all in half.
Jeez.
and then you take each half.
One
Yep.
half of each, and then you take a half, and then and then you take a half from the bottles that you know, and you cut those in half, and then you take a half of each of those.
Yeah. I guess an easier way to think about this is we know we have 1 of pill X and 2 of pill Y. If you take 1 more pill X out of the bottle, and now you've got 2 and 2, and then just cut them all in half,
Oh, there you go.
and then put each half into 2 separate piles, although you wouldn't know which half belongs to which pill, you would guarantee that each pile contains a full pill X and a full pill Y. Moving on to segment 3, this is a really fun game. Similar to the game Balderdash, I'm going to give you a proper noun, and you will have to come up with the definition. I think I've picked some words that you have probably not seen before. There's a chance you have seen them. So you might be kind of making up your definition, but I will still be as fair as possible in deciding who actually came closest.
I think Travis is going to be really good at this.
Does that
I feel
make
like
sense?
you know all these things.
I don't know what he's going to
You're
say
so
at
well
all.
read.
Okay.
I have no idea.
You read that
Are
book.
these medical words or are these?
Yes.
I feel like I know a lot of medical words.
Yeah.
They all are medical.
I don't know. When they tell me medical terms, I'm like, I don't know what you just said to me. Please put that in layman terms.
So, and I did try to pick some that are kind of at the intersection of medicine and pharmacy. So it should be very fair, but we'll see. Okay. So number one, since Callie answered first for the Get to Know You questionnaire, Travis will answer first for this first one.
Okay.
And your word is sippy diet.
Sippy diet.
Yep. It is SIPPY diet. What is a sippy diet?
So sippy has to be an acronym. That's my guess. And so, yeah. So am I just confidently telling you what it is? Basically. Oh.
Yeah. Yeah. Extra points for being extra confident here.
Okay. Yeah. A sippy diet is actually a diet that is completely liquid and one that you are able to consume when you have issues like with when you have your jaw wired shut or something like that, and so it's one that you actually have to sip to consume. That's a sippy diet.
All right. And Callie, what is a sippy diet?
So I feel like I had a similar idea to Travis, except that all of the liquid has to be in a sippy cup and be blended so they can drink it through the sippy.
Okay. And you've got to make your answer a little bit different. So what is yours to treat? If his is to treat a wired shut
This is to treat people with
jaw.
massive abscesses that are untreated and maybe potentially like Ludwig's angina, just for those people that are on airway watch in the ICUs or something.
Okay, so now I have to decide which of these is closer. I'll read you the correct definition. Maybe you can help me think of which is closer. So it's named after Bernard Sippy, so I'm not going to be able to give you points for it being an acronym. And it's a bland diet for the treatment of peptic ulcer disease, consisting of measured amounts of milk, cream, farina, and egg.
What is that?
Farina is a form of milled wheat.
Okay.
It kind of looks like oatmeal. Looking at it here, we're gonna go a half point each on that one.
Okay, nice.
I cannot confidently say one of you was closer there. So it's gonna come down to this next one. And Callie, you're gonna have to answer first on this one. What is a USP regimen? That is YUZPE.
A USP regimen is a way to wrap open wounds and keep them moist and aerated so that they do not fester and become infected.
Okay.
That's a USP?
USP.
A USP regimen.
Mm-hmm. All right, Travis.
Yeah, obviously, USP regimen is a discharge at-home regimen that you instruct your cardiac patients to do. It's a workout regimen that's easy to, initiate and follow in a heart-healthy manner.
Okay.
It does sound like a Russian cardiology regimen, doesn't it?
Again, this one is going to be so hard to get any points on. I'll tell you the correct answer. So it's an outdated form of emergency contraception.
Oh, no.
So it involves
close.
Yeah.
Very close.
It involves using regular birth control pills as a form of emergency contraception. Mm-hmm. Only birth control pills that contain both estrogen and progesterone can be used for the USP method. It isn't as effective as our more updated forms of emergency contraception like Plan B or Ella or the copper IUD, but was shown to have some efficacy. I think I'm going to have to go a half point on each because Callie said it was a method of wrapping wounds. Travis said it was a workout regimen. I don't know if either of you want to concede this point.
So someone has to get a point?
No, I can give a half point.
We both get 0 points.
I mean, I was like, that is overtly wrong.
Okay.
I do think I remember.
We were incorrect.
Yeah.
That's how I would interpret that.
I think I remember learning about that in pharmacy school, but I don't think that it was tied to a name, But then again, who knows?
Yeah. And we're not endorsing this method, but it is interesting that can work as emergency contraception. Essentially, you just take double the dose of normal birth control, like every 8 hours, I think is what I read. Next one. I guess we're going back to Travis answering first. What is a Bezold-Yarish reflex? It is spelled BEZOLD JARISCH.
Yeah, the Bezold-Yarish reflex is it's when your cells actually have a really aggressive immune response, and so you end up basically spiking a fever when you get any cell lysis.
Okay. Cal, you want to come up with
Sure.
an alternate definition here?
Yeah, so I would say that this reflex is when you ingest a substance that forms a ball, because it sounds like a bezoar to me.
Okay.
And that reflex is when your peristalsis stops because of the substance that you've ingested. I
Okay.
don't know if that really counts as a reflex, but
That's interesting. I'm tempted to give it to Travis on this one because it is more cell mediated. So this is the trigger is more a sudden reduction in left ventricular volume or pressure, such as a massive hemorrhage. But it can also be triggered by administration of certain drugs that act on cardiac receptors.
yeah, so nothing that I said there
So I think
was related to that.
I'm going to give the point here.
The only thing I could think of was the Jarisch-Herxheimer reaction, and I wonder if Jarisch is the same guy.
Maybe proliferative.
Yeah.
Yeah, very well could be. We'll leave it to our listeners to look that one up. But you didn't quite nail what the response is. It's actually a triad of responses: bradycardia, apnea, and hypotension. So they're all somewhat cardioprotective reflexes in the setting of like massive hemorrhage. An interesting one, but I feel like there's other reflexes that kind of happen in massive hemorrhage that kind of take over.
It sounds like they're dying. You know, they're bleeding out, and look
It's
at
a
this.
reflex.
Their
He
heart
found
rate,
it.
yeah, exactly.
Okay.
Their heart rate's slowing down. They stop breathing. Their blood pressure's dropping. This is a reflex.
Yeah,
It's like,
exactly.
oh,
You're just mad you didn't find it yourself.
I can name it that. It's ridiculous.
You should do that next time somebody is hemorrhaging in your trauma bay.
What?
What is it? What's it called?
Bezoid, and I said Yarish because that's what I looked up on Google.
That might
but
be right.
It
I
might
don't
be
know.
Jarish.
Please
No,
tell
I
them
mean,
that
maybe I've been pronouncing
in
it
the
wrong.
middle of the trauma room, if they're having a Bezoid
Oh,
Yarish.
yeah, they're having a Bezoid-Yarish reaction.
If I was in a front room with you, I would just like look at you and like shake my head, like, what are you talking
So
about?
ridiculous. Now I'm mad. This is a thing. The person's dying, and we just found a way to name it after some person. Ridiculous.
All right, Callie, I think you got a chance at this one. What is a dram?
A dram is a little boat that you weigh things in, and a dram is a unit of measurement for that weight.
Okay. Travis?
Interesting. A dram is another name for the sheet that separates the surgeons from the anesthesiologist in the OR.
That's a great response.
I really like that, but Callie's much closer on this.
She's like very confident in that response.
So at which point you guys are tied, but I will read you. A fluid dram is defined as 1/8 of a fluid ounce. I guess a lot of pharmaceuticals used to be measured in drams, but that has been entirely replaced with metric units. But fluid drams are still used to measure the capacity of pill containers, apparently, for whatever reason.
Yeah. So I know that I learned something about that in compounding.
Yeah, I feel it might still force first-year pharmacy students to learn about drams. But okay, so we're going on to our tiebreaker word.
Man, I just embarrassed a lot of compounding pharmacists.
You did say measure though, so I think
At least I knew it was a measurement.
all right. We're going back to Travis to tell us what is Burton's line.
Burton's line.
Burton's line.
Yeah, so Burton's line is the altitude at which, when you cross it, your risk of pulmonary edema or cerebral edema becomes very high.
All right, Callie.
Burton's line. It is the line in which something becomes more toxic and you start developing symptoms and side effects of a medication is Burton's line. It's not like the lethal dose or the therapeutic dose. It's the dose that gives you side effects.
Okay, we're going to go no points on this one yet again, but we're all going to learn what Burton's line is. It is the blue purplish line on the gums seen in chronic lead poisoning.
Ah, wow.
So,
Wow, you really should have gotten that one.
Gosh, well, I think I
Something you can start
remember
looking
hearing
for.
that with like step. I was studying for step 1.
I've never heard of that in my
Burton's
life.
line.
Burton's line.
Gosh, part of me wanted to say something anatomic, but then I just thought of Burton as like a ski and snowboard thing.
That's what I thought too. That's where my mind was
I'm going
is
to
that where like
altitude
the snowboard hits you on the back and then you have a Burton's
Yeah,
line?
yeah.
That's like what I first thought.
I might have given you a point for that because it is a line on the body, but yeah,
yeah.
blue purplish line. So, okay, so our tiebreaker is, we're going back to dram. How many milliliters is a dram?
28.87.
Okay, Callie's going
Wow.
28.87.
Okay. The fact that you're going down to decimals is really concerning to me. I'm going to have to go 28.88.
And Callie is our victor, as it is 3.7.
Oh, no. I should have gone lower.
That was like ounces or something. I don't know.
You might have heard me in my definition say it's 1/8 of a fluid ounce, and you gave me an answer that's a lot closer to a fluid ounce.
Okay, that's what I thought. Hey, but that's pretty close.
But yeah, and so Callie
You
will
should have
win
$1
that
it.
segment.
Nice. Yeah.
Moving on to segment number 4. This is the number needed to treat game. And credit goes to American Family Physician and their podcast. They often play this game on their podcast, and I hope they're okay with us trying it out. It seems like a very fun game. What I'm going to do for this is I'm going to give you a treatment and a disease, and I've used the NNT.com to look up what is the number needed to treat. So number needed to treat for our listeners is the number of people with the disease that you would need to provide treatment to get one successful response. So if it's the antidote to a poison, it's how many people that are poisoned would you have to give them the antidote to save someone's life. And the lower is better because then if the number is 3, you only need to give it to 3 people to save a life. And these numbers can be all over the place, and they give us a good idea of the effectiveness of different treatments. All right, Callie will go first on this one. So the treatment is corticosteroids for the treatment of Kawasaki's disease in children. Number needed to treat to reduce the outcome of coronary artery abnormalities.
I think it's low. I think it's going to be like 12.
All right, Callie's going 12.
Wow. I mean, this is a total shot in the dark. I'm going to go higher. I'm going to say 20.
All right, the number is 10. So
I
point to
thought
Callie
10.
there. Pretty important treatment. The NNT gives it a rating of green. So that's the benefits NNT, and for harms, there were no reported harms with corticosteroid use for the treatment of children with Kawasaki's disease. For our next one, this is with the treatment of aspirin within 48 hours of an ischemic stroke to prevent death or dependence.
Yeah, I will guess 15.
All right, Travis is locked in at 15.
I'm actually going to go higher. I think it's like 150 or something.
Okay, Travis is going to be closer on that one. The number is 79. So yes, 1 in 79 to prevent death or dependence by giving aspirin, 1 in 140 to prevent a recurrent stroke, and 1 in 89 will get complete recovery from the stroke with that aspirin therapy. This one does have some associated harms. It's 1 in 574 to cause a symptomatic intracranial hemorrhage, and 1 in 245 to cause a major extracranial hemorrhage.
That's a lot. That's like way higher than I thought it would be.
But it still gets a rating of green from the NNT.com as being a relatively safe and recommended treatment after an ischemic stroke. All right, next up, this is tranexamic acid for the treatment of epistaxis. Number needed to treat to prevent 1 episode of rebleeding.
1 in 50.
Okay, I was thinking 50.
I'm going to go like 4.
Going 4.
Wow.
That is very close. The actual number is 5.
Wow, yeah.
So TXA, and then That's to prevent one episode of rebleeding, and there was no differences in adverse events. All right, so that's a point to Travis. The score is 2-1. Going into our last one, Callie can tie
Redeem
with this
myself.
one. We have antibiotics for culture-positive asymptomatic bacteriuria in pregnant women. Number needed to treat to prevent pyelonephritis.
Ooh, I would say like a low number, like 7.
I mean, I think it's going to be actually very high. I'm going to go with 100.
All right, the correct number, Callie got it on the head here.
no.
was
Yeah.
7. Yeah. And so we're tied.
It's asymptomatic, and you
But
get.
it's a pregnant lady.
No, I know. But
Okay.
that's what I'm saying. Like I am surprised.
Yeah, and thinking back to my studying for the shelf, I believe it's because the smooth muscle of the ureter is inhibited, and so bacteria can flow back towards the kidney a little bit more easily in pregnancy. So yeah, 1 in 7.
That's crazy how like high the risk of pylo is. Like I wouldn't have figured it would have been that high. That is interesting.
All right, we need a tiebreaker here. There is another benefit to treating asymptomatic bacteriuria in pregnant women, and that is a 1 in 9 to help this. What do you guys think? Can either of you guess it? I guess whoever guesses it first will win.
Wait, so this is.
Symptomatic
Can you read
bacteria.
that again, please? Yeah.
No,
Is it just PPROM?
I'll give it to you. It's preterm birth.
Okay.
A 1 in
one.
9
That's good.
to prevent preterm birth by treating asymptomatic bacteriuria. And then 1 in 20 were helped to prevent low birth weight, and there was no harms reported. So very effective. Also got a green rating. Everything that was part of this segment did get a green rating from the NNT.com. All right, we're moving on to our last segment here.
Oh, wow.
This one is called Extreme Survival Challenge. So you two must work together to answer the following question to the best of your ability within 5 minutes. The scenario is as follows. You have been teleported back in time to 59 BC and have been dropped in Rome just as Julius Caesar has taken control of the Roman Empire. Your goal is to survive and gain as much power as quickly as possible. What 3 medications are you bringing with you? You get unlimited amounts of whatever 3 you bring.
Okay,
Wow.
so do we want to do this in like a dark and sinister way? Or like do we want to do this in like a heroic
We want
and
to-
benevolent way?
Yeah, interesting. I mean, so we want to survive and also gain control,
Gain power,
gain power.
right? I mean, if you can come up with a system to take the throne, become the
Wow.
emperors.
So here's my thoughts. We could either save the world with penicillin or we could make everybody addicted to a drug and hold all the power to
Well,
it.
how many drugs we get?
Yeah.
You get 3.
Okay, wait, we can do both.
This makes me kind of reflect on who I am as a person these days.
Okay. So one, I mean, I think that, yeah, having something that does, obviously, I think an antimicrobial
Yeah.
is for sure on the table.
I feel like there wasn't a lot of resistance back then because they probably didn't exist. So you could get away with like a penicillin. But if we want to do something like meropenem, we could.
just really get
We
them.
really could. It's fine.
Just lead to terrible,
Yeah,
just
terrible.
adverse outcomes
Exactly.
and toxicities today.
Yeah.
Um,
The world would be gone by now.
okay, maybe a penicillin. Here's the other thing. What
What
about?
about like Augmentin? I feel like nobody hates Augmentin.
Yeah, Augmentin's good.
Okay.
Okay. Now, what about this though? What about a pain medicine?
Yeah, that's
You
the
know?
other part where I was like, fentanyl.
Yeah, maybe. Okay, but what instead? Okay, to gain power, what if it was like ketamine?
Okay, I
or something. That's
thought
not,
you were going there, and I love it.
Okay.
Because there's so many uses. You
Yeah.
really could use ketamine. I think it would be probably more useful.
I mean, and to also like gain power. I mean,
Yeah.
are you kidding me? If you gave people, recreational doses of
Yeah,
ketamine,
they would
and were
love
like,
that.
hey, let me tell you, I have this, and I will tell you how the world works, and and let me show you, right? We
Yeah.
could become deities.
yeah,
you
that's
know?
true. I do like that.
So
Yeah, they'll have some experiences. With
exactly,
ketamine, yeah.
right? And then we could make them scary, or we could make them very, very
Yeah.
happy. And so
Yeah,
that's the
I think
power
that's good.
play we use.
Yeah, a little less worrisome with the breathing.
Exactly. And then
Not zero, but a little less.
We talked about nitroglycerin earlier. What if we take, chest pain, but fire. Okay, explosions.
You would need like so much though, wouldn't you?
We have an unlimited amount.
Do we have an unlimited amount?
You do have an unlimited amount. I picture it as sort of like a briefcase that you can open,
okay.
take out as much as you want, you close it, open it again, it's refilled.
Oh.
Okay. Yeah, what about, just that's interesting, using nitroglycerin, we could have the ability to move mountains. Okay.
Literally. Yeah, make like tunnels and stuff. Okay, wait, hold on. Okay, so we agree on.
So we're helping people.
Augmentin, but because we're stewards.
Because we're benevolent.
Yeah,
and we are making the world better.
We're stewards.
And we are stewards of
most important.
of our. Okay, yes, I like this.
And then I do like ketamine just because we have to include that in every podcast.
Pain control. Recreation.
It could be anesthetic too, honestly.
Oh yeah.
Put somebody out.
And then that's also our power play because that lets us
seizures.
Exactly. We're the controller of worlds and minds with the ketamine. So I like.
Is there
that
anything
one.
like we're missing, like as far as like,
I think just a plan for how are you going to go from day one? You're dropped in Rome. You've got these 3 suitcases
Okay, fine.
of
We'll do nitroglycerin just because that gives us
for the
the
explosives.
Are you going to set up a little
also
shop
we're treating Angela.
or?
Yeah.
Okay. So you want us to? You're giving us this completely hypothetical scenario, and now you want us to be pragmatic about how are we actually doing this?
So first step is that we go into the slums of Rome and we find a sick child, and we give them Augmentin, and they're healed.
Okay.
And then everybody is gonna say like, "Wow, these two, they're healers."
Okay.
Healers, and then we say, "Oh my gosh, come to us with all of your pains." And then people start coming with their pains, and we microdose ketamine, and then they're hooked.
Right. Okay. Then they're like, wow, these people are true healers. But then that's when we start to like veer off and are not like, we're not just healers. We are
we
also
got fireworks.
We are deities, and we are.
Look at this explosion.
Yeah, and then also you can try to close your eyes, but it won't change. You see, and that's where the ketamine comes in again.
Yeah,
and
exactly.
Then wow, the sober people will see the actual explosions.
Yeah.
And then it's like, whoa, this is
what is happening.
These people are the real deal.
Yeah, and then we get the eye
power.
of the rulers, and they say, "Wow, these two know a lot." We become the official healers and the official road builders, if you will,
and
explosive.
potentially priests.
Priests.
Yeah.
And then we blow up mountains.
And then power begets more power.
Yeah.
And then
I don't know where this is going.
No, but I think that is the combination.
Yeah.
Augmentin, ketamine, nitroglycerin.
Natural play.
That might be the right answer.
I think that is the only answer.
All right, your 5 minutes are up. That was very entertaining. I think it's time we wrap this up. So thank you for that very enjoyable discussion. Thank you for coming on the pod, Callie.
You're welcome.
Travis, Dr. Barlock, always good to have you.
Yeah, thanks, man. This is super fun.
All right, yeah. Hopefully we can do this again sometime, and we will wrap it up there.